Hey, hello everyone. Good morning, good afternoon, and good evening, depending on where you are in the world today. And we welcome you and we thank you very much for joining us for this month's SIHI Talks. And I am Hannah. I am the Hub Manager of the SIHI Philippines Hub, and I will be your moderator for this session. So SIHI Talks is actually a monthly webinar series that aims to provide a platform for existing and also for potential SIHI partners so that we can explore new partnerships or expand on existing collaborations. It is hosted by the SIHI Global Network Secretariat. And specifically for today, the session is co-hosted by the SIHI Philippines Hub, and it will feature the Community Engagement Self-Monitoring or CSM strategy for social innovations in health that was piloted in selected communities here in the Philippines. So without further ado, I'd like to call Dr. Beatrice Halpab for her opening remarks. Dr. Halpab is a co-founder of SIHI and is the lead for SIHI at TTR. So Dr. Beatrice, the virtual floor is yours.
Thank you. Thank you very much, Anna. Thank you. Also, I'd like to thank the Secretariat and the SIHI Hub Philippines to give me this opportunity to open this SIHI talk. Thank you so much. And I have the pleasure to actually welcome you as well to this amazing monthly events, and would like to engage you to keep on coming and joining. So yes, it's a pleasure to feature the community engagement and self-monitoring project that was initiated in the SIHI Philippines. And community engagement self-monitoring it's a strategy to empower actually the community to design community engagement processes and monitor at the community level their performance and as well as their progress and impact. And that allows community to develop ownership in their social innovation and also to enhance their performance and sustainability. So we feel that this is a very important step forward. TDR has been engaged in this, and the first step actually was to build upon such a community engagement self-monitoring strategy to build it upon on the work of Professor Uche Amazigo, that is among us today, and you will hear later on. And she pioneered the work of community engagement for the control of onchocerciasis, as she was a director of a WHO program of African Program for Onchocerciasis Control from 2005 and 2011. And Uche has developed at that time the community engagement self-monitoring for the onchocerciasis control. So what has been done this time now is to adapt that strategy for social innovation and tested it in the Philippines. It was tested, then it was readjusted and improved based on the lessons learned, and it can be really scaled up to other countries, and that's what we are looking at. And the SIHI Philippines would like also to develop a manual actually to help that scaling up across countries together with hubs and other partners that are interested. So this is a great potential, as it can really go and help social innovators to take full ownership of their own, to take community members and social innovators to take full ownership of their own performance, monitoring them, understand what works, what doesn't work, and then be able this way to sustain their innovation. So it has a great potential impact, and that is why we feel it's an opportunity to promote this. So this actual SIHI talk and this session is really aiming at promoting such an approach, introducing it, explaining a little bit the global perspective, discussing the best practices, encouraging the audience to adopt such a strategy in their community if they feel it is appropriate. There will be discussion, there will be panel discussion that will go through basic information about the community engagement strategy, current work and strategies with an emphasis on those related to social innovation in health. There will be discussion on goals, plans, and potential points for collaboration with the CI hubs and other organizations. So I will now let and give over to you back, Yana, and start this amazing program. Thank you so much, all of you, and thank you. Welcome to everyone, and thank you for being here with us.
Thank you, Dr. Beatrice, for that warm welcome and for providing us with a short history of the CESM and for the purpose of this session. We don't have much time today to provide an introduction of the SIHI Global Network, but for our guests and first-time participants and for those watching the live stream as well, we invite you to explore our website, socialinnovationinhealth.org. You may also visit and like our Facebook page, Social Innovation in Health Initiative, and do follow us also on Twitter at SIHI Global. So we will now proceed to the main part of our session. And to kick this off, Dr. Pauline Tiangco will give us a presentation about the implementation of the CESM strategy. Dr. Pauline is a research associate of the SIHI Philippines Hub, and she is the project coordinator for CESM. So Pao, take it away.
Thank you very much, Mama Hannah. So good day, everyone. I am happy to share with you the community engagement self-monitoring strategy implementation in the Philippines, which has 2 phases. So I'll do my best to summarize what our communities have been doing for the past 2 years in 15 minutes. All right. So first of all, how did this idea come about? Next slide, please. So social innovations in health, as we know, have been shown to enhance public health sector delivery, capacity, prioritize impact, agility, and sustainability. These must therefore be scaled up, sustained, and integrated into our existing health systems. However, monitoring and evaluation in the Philippines still largely follows a top-down approach with little involvement from the community. Hence, there is a need to explore community-grounded, community-managed, and contextualized approaches to the monitoring and evaluation of health intervention performance and implementation. In this regard, the Social Innovation in Health Initiative engaged selected communities in the Philippines to implement a community engagement self-monitoring, or a CESM strategy, with a focus on social innovations among urban and rural communities. Next slide, please. So first, okay, so just a few house rules. Please make sure your microphone is muted. And if you have any questions, please do reserve them at the end of the discussion. Okay, so let's first define what CESM is. So this allows communities to be involved in the entire process of monitoring, where they can plan, design, and implement how to monitor the projects they have as they deem fit. Next slide, please. So let me just walk you through our process. So we selected 2 social innovations from a pool of previously identified social innovations. So they were able to meet the following criteria. 1, they had to be community managed, not just community based. They had to be co-designed by the community, the social innovation, or it must have a strong community participation component. And it must also be ongoing during our project implementation. So we were able to select 2 groups. We have Kalinga Health and the Seal of Health Governance. So we had dialogues with them. We had social preparations. And these 2 were actually designated into 2 distinct groups, which we will be tackling as we go along. So just a brief overview of the innovations. So first we have Kalinga Health. Okay, so it is a 360-degree social enterprise facility that focuses on service delivery for tuberculosis care, from detection down to management. So this was designated as the community managed group. So what does that mean? being in the community managed group, next slide, please, they were to follow the steps there. So the community identifies the project monitoring indicators they will be using. So they selected their own local monitors. So we will be discussing what the roles of local monitors are in a bit. And essentially, they were to take charge of the entire process from planning, design, data collection, analysis, interpretation, and also feedback and assessment. So what's important here is that Kalinga Health, or the community from Kalinga Health, did not receive any form of intervention or support from SIHI, not even from the social innovator. So this was based in a city in the Philippines. Next slide, please. All right, so now we have the Seal of Health Governance. It is actually a health leadership and monitoring program in itself, which encourages community leaders to be actively engaged in addressing their community's concerns. So they developed their own scorecards, they participated in leadership programs, and essentially it was them who provided out-of-the-box solutions to their community's own challenges. And this was designated as the SIHI Co-Managed Group, which means that the only difference between this and the other one is that they initially received minimal assistance from SIHI. How? So we provided them with the list of monitoring indicators that they can choose from. However, it is important to note that it was still up to the community to decide which monitoring indicators they will be using. Okay, so essentially they went through the same process. Next slide, please. All right, so just a few definition of terms. So we have the following key persons. We have our innovators, and then we have our documenters. So documenters were actually designated by our social innovators to document and to observe our communities as they implement the strategy. So they also served as SIHI's link to the communities and vice versa. But it's important to note that they were in no way involved, or they did not interfere in any way with these communities' processes and dynamics. And then we also have our local monitors. So our local monitors are community selected volunteers who also belong to the community where the social innovation is being implemented. And their main task was actually to collect data. However, as we go to phase 2, we would notice how their roles and responsibilities actually evolve. Next slide, please. Okay, so this is just an overview of the entire process. As previously mentioned, we had social preparations and community dialogues. We also have CASM workshops. So these just refer to the internal meetings that they had to select monitors, to determine indicators, and to plan the rest of the implementation. So for the data collection or the implementation proper, so for the Seal of Health Governance, what they did was house-to-house visits. So a local monitor had a designated catchment area to survey. And because they had to cover a lot, so there are around 400 to 500 households per village, and there were 20 villages to cover. So because they had a lot to cover, they were able to do the monitoring once for the entire duration of the project. And then we have Kalinga Health. So the local monitors of Kalinga Health have access to a online dashboard. So because they have this technology, they were able to do the monitoring once weekly. All right. So the next slide, please. Okay, so just to show you a few pictures of the data collection that happened. This was for the Seal of Health Governance in our rural setting. All right. Okay, so one of our objectives was to really describe the community's processes and dynamics. Hence, the presentation of our results will be based on the step-by-step process that they went through. All right, so in choosing indicators, our local monitors deemed that it was necessary for it to be important, to be feasible, and to be practical. And then when they selected their local monitors, they said that familiarity with the community and the interviewing skills of these individuals are important factors. And then during data collection, so active participation, co-creation are really important elements. And it was perceived that the perception and trust of the community in the innovation and the strategy's purpose and utility are really important elements in the level of engagement and commitment of these community members. Next slide, please. All right. So of course, they were met with some challenges. So one of which is their difficulty in creating the survey materials. So because they had difficulty translating the indicators into actual questions that they will be asking the community members. And then they also had trouble encoding data. So this was particularly significant for Seal of Health governance because they are in a rural setting. So they usually have just 1 to 2 computers per facility, and only 1 to 2 people were trained to really use it. So that was also a challenge. And there was one local monitor who mentioned that this was not part of their job. So she was not really motivated to participate and to become a local monitor. And respondents were also not always available. So this was particularly evident in the Seal of Health governance because they did house-to-house visits. And this was understandable because, of course, people had work, they had other commitments. And later on, you will see how this was worked or how we worked around this challenge. Okay. And then the lessons learned. So engagement really takes time. So we cannot impose our own timeline into the community's timeline. We have to always consider what they deem feasible, what they deem practical. And leadership really matters because no matter how skilled your local monitors or your community leaders are, if they work alone or if they don't have any support, for instance, from the higher level government units, then these are not likely to be sustained. Also, it must always be tailored to what is practical and feasible for the community. Next slide, please. Okay, so in phase 1, the question we actually wanted to be answered was, is CESM a viable strategy? And the answer to this was yes. So we proceeded to phase 2, which answers the question, is it a sustainable strategy at the community level? Okay, so for this, remember in phase 1, we had 2 social innovations, but for phase 2, we decided to focus on just one, and that is the Seal of Health governance. And from the 20 villages there are in that area, we only chose 2. So we chose these 2 communities because they had varied levels of engagement and participation. So on the right, we have Barangay Kaub. So this community already had a systematic system or mechanism in place. And then on the right, we have Barangay Tuboran. So they had very high potential for improvement. Next slide, please. Okay, so let me just discuss to you the process. Essentially, they followed the same process except for a few added elements. So we have the praxis, the capacity building sessions. So this was based on the challenges that they encountered during the first phase. So we built upon this, and then we had sessions that were focused on this. And we also had praxis sessions because we wanted them to undergo the process of action, reflection, action, where the communities will be capacitated to do something, reflect on it, think of what works and what does not, and revise it according to these observations. And then again, act according to what they found and what they have improved upon. Then we also had profiling of our local monitors because we wanted to get to know them more. And also we had self-assessment or self-evaluation for the first and the second phase. So all these were grounded on the people-centered approach. Because again, we know or we want to recognize that the community is at the heart of the strategy. And of course, we still have to enable other stakeholders, other organizations to coexist and to co-manage. Next slide, please. All right, so for the profiling of local monitors, here are the pertinent results. So 96% of our local monitors are females, 65% reach the high school level, 100% have monthly earnings less than 9,520 pesos. So this amounts to roughly $200 US. So they're actually at the lowest level when comparing it to the income brackets of the Philippines. And 93% belong to an organization and are active members of it. So this just goes to show that high educational attainment is not necessary, is not required, as long as you are active and you are motivated to participate in the initiatives of the community. Next slide, please. Okay, so continuing with the results, we have perceived competencies. So we had, as mentioned earlier, a self-evaluation or a self-assessment for the first and second phase. And it was asked there. So we were we deemed to check if it was important for them, if that was something that they did during the first and second phase. And we found out that during the first phase, our local monitors gave importance to interpersonal and communication skills. So they think that building rapport is very important as they did their role as a local monitor. But during the second phase, we found out that the level of importance ascribed to data processing and analysis have increased significantly. And we actually want this, or we were happy to know about this, because this was actually one of the focus areas of our capacity building and practice sessions, because we wanted our local monitors to go beyond just collecting data as previously defined earlier. We wanted them to also know how to use it, how to make sense of it, how to process and analyze it, and how to disseminate it to the community, and how it would inform their future projects and initiatives. Next slide, please. Okay, so for the competencies gained by our local monitors, so they improved their ability to analyze and communicate the realities of their communities, particularly in terms of health and in terms of leadership. So to be specific, there were changes or improvements in how they analyze their health status, the status of the community, participation, the importance of it, and leadership. So you would see it actually connects to how Kaog defined it. So for them, CESM is a good project because they learned a lot from it, especially when it comes to health. And this is a big help for them, and they are proud of it. So through it, they served as role models for the barangay. So this is where we see leadership comes in, where participation and encouragement of these local monitors for the community to participate are reflected or are evident. And then for Tuboran, so according to them, CESM is a means of assessment where the health needs of each household can be determined so that appropriate solutions can be done. So here we see that they realize its importance and that they are motivated to do it because they believe in its purpose. Next slide, please. Okay, so for the mapping of potential local monitors, we asked them, who do you think or what characteristics should an individual have to be a good or an effective local monitor? So according to them, good communication and social skills are necessary, and being familiar with the community is a plus factor. And when we asked them who the possible local monitors could be, next slide, please. So they identified the following people. So the youth, community leaders, constituents, and essentially any individual, as long as they are willing to be part of the CESM project. So this we can also connect to the profiling. If you would remember that high educational attainment is not required for as long as the person is motivated to work. All right. And then next slide, please. Okay, so we have this very colorful ladder of participation. So we see that Tuboran is between consultation and placation. So their local monitors actually actively participated, although there were some limitations in terms of decision making, and this was largely attributed to the lack of support they received from some of their village leaders. So according to them, the village leader who's supposed to be leading them was not always present, and so they had difficulty moving forward. And we would see Kao. So they are, or it is between partnership and delegated power because they have direct involvement in decision making with the support of their village head or village chief and the counselor for health. So we would see how important proactive leadership really is. Next slide, please. Okay, so these are just some photos of the capacity building activities and the praxis sessions. Next slide, please. Okay, and this one was taken during the second capacity building activity. As I mentioned earlier, we wanted them to go beyond just collecting data. So here they were the ones who presented the data to us. And this is not usually observed in the community. It's usually the village leader who does this. But we wanted to really capacitate them, and we wanted to let them realize that they can do it and they can disseminate and they can be part of all phases. All right, so for the lessons learned, these were direct quotations from our local monitors. So the first, basic needs must first be fulfilled in order for us to effectively fulfill our duties as local monitors. So I believe this is common knowledge, so this is like common sense. but we would see that it's still not being observed in all our communities. And this is actually an important factor. And then another would be, during the first phase, we really had a difficult time understanding the indicators. I was thinking, what are these for? Since there was no workshop to guide us, this workshop is really a big help for us. So we would see here how the praxis sessions and capacity building sessions came into play. So they provided safe spaces for grounded reflection and learning exchange to ensure the relevance and the sustainability of the CESM strategy. And then CESM has been a helpful tool for us. It's not only relevant in health, but also in other projects. So this is actually one of the highlights of the lessons that they learned. So they realized that the strategy is not confined to health alone. So they shared with us that they are actually building a restaurant in one of the tourist spots of their village. And they plan to do or to apply the CESM strategy in that. And I asked how. And they said that because in a food business, cleanliness and sanitation are very important. And those are largely connected to health. And in order for them to sustain the operations of the restaurant, of course, they would have to monitor, they would have to evaluate, they have to be there in every step of the planning, implementation, and even the monitoring and evaluation. Okay. And another is our barangay captain or village head would lend us her boat or provide us with supplies needed so we can carry on with our tasks as LMs. So this is specific for Kaob. So you would see a boat because they're actually an island barangay. So you would need a 30 to 45-minute boat ride to reach them. And despite this challenge, they were still able to do what was tasked of them and what they deemed was necessary because of the support of their village leaders. So we will see here how proactive leadership and political commitment comes into play. Next slide, please. Okay, so for our conclusion, letting community members monitoring their projects highlights the importance of developing a sense of ownership and partnership in ensuring the sustainability of an initiative. So CESM has been proven to be a viable and a sustainable strategy that can be integrated into initiatives that extend beyond health. And people-centered development as applied in CESM and as reflected through the capacity building activities, the praxis sessions, involves recognizing community members as agents of health leadership and exercising collective effort. So again, we put our community members at the heart of the innovation and at the heart of the strategy. But we also enable other stakeholders, other organizations, the other community leaders to take part in it and together collaborate. Next slide, please. So a few of our recommendations include integrating the self-monitoring and evaluation strategy in the health programs and innovations of the community, providing platforms to engage and support the community in this process through strengthening political commitment and institutionalizing the process through policy. And we also aim, as Dr. Beatrice mentioned earlier, to develop a CESM toolkit to serve as a guide to other implementers or communities who would like to try this out. And further studies may explore the strategy on a larger scale or in a different setting. So just a few more words. So the project has proven that listening to the community and recognizing their local initiatives in the context of diversity is a vital element in promoting ownership and ensuring sustainability. So I hope I was able to discuss it well, and I hope I made it on time. Thank you very much and have a great day.
Thank you very much, Pao, for that inspiring and comprehensive report showing us the step-by-step process of the CESM implementation and for sharing the initial gains, particularly on increasing community participation and the other insights on the implementation. At this point, Dr. Pao will now be joined by our other esteemed panelists, and please allow me to introduce them to you. First, we are very pleased to have with us Dr. Jason Alacapa. He is the founder and the Chief Executive Officer of the Kalinga Health Innovation and of Innovations for Community Health. Dr. Jace, hi.
Hi, everyone. Good morning, good afternoon, good evening. So thank you for this opportunity to share your experience. Thank you, Hannah, and the
Thank
SIHI
you
team.
for being with us today. Next, we are also very thankful for the presence of Honorable Alfredo Coro Jr. He is the Municipal Mayor of Del Carmen, Surigao del Norte, and of course, the innovator of the Seal of Health Governance. Good evening, Mayor.
Hello, good evening, good morning, and good afternoon to wherever you are. It's been an honor and privilege to be here and share experience with everyone. Thank you.
And with him, we are happy to have with us also Honorable Raquel Barquilla. I hope she was able to reconnect. She is the barangay captain or the village head of Barangay Kaup, the island barangay in Del Carmen, Surigao del Norte. Good evening po, Cap. And I think we also have with us some of the dedicated community volunteers or the local monitors from Del Carmen. We have Ma'am Delia Gonzalez and Ma'am Jelly Kalayag. Maybe later on they can also turn on their videos. I actually see Ma'am Delia already. And last but definitely not the least, we also have Dr. Joey Escalzo. She is a professor at the Surigao del Norte State University, and she is the field documenter and local coordinator of CSM in Del Carmen. Hello, Dr.
Good
Joey.
morning, good evening, good afternoon, everyone. Thank you for having me here. It's my pleasure, po.
Thank you, po. And I would like to ask the host of Jory, can we spotlight or pin all of the panelists at the same time? So Dr. Jason, yes, Pao, of course, Ma'am Raquel, Ma'am Delia, yes. And of course, maybe Doc Meredith also if she wants to join the panel. Okay. All right, and of course, we invite our audience to participate by posting your questions in the chat box, and we will try our best to manage the time and present all of your questions to the panelists. So, I don't see any questions yet, so I think I'll throw the first one. I would like to ask this specifically to Dr. Jason and also to Mayor Coro, the innovators. So Dr. Jace, so of course Kalinga Health and ICH, I know as a whole have its own monitoring and evaluation strategies, of course. And Mayor Coro, as mentioned earlier, your innovation, which is the Seal of Health Governance, actually has a big monitoring component in it already. So how do you think is CSM different or unique, and what does it add to your existing M&E activities in your organizations? So anyone, maybe Dr. Jace and then Mayor.
Sure. Yeah, thanks for your question, Hannah. Yes, you are right when you said that we do have our own M&E activities. And in fact, as mentioned by Dr. Pao earlier in her discussion, we do have a dashboard to monitor our progress on certain milestones. But just to correct, it's not anything complicated. It's just based on Google. It's a Google-based analytics dashboard. We just made it somehow fancy. But then again, the key advantage of having these local community monitors is about increasing the lived experiences and the voice from the ground. I think this is something that is shared across between the two experiences or innovations. But I think what's more helpful for us being an NGO, technically speaking, a private entity, it strengthened the voice of people on the ground and from the government. So I think this is helpful because at the end of the day, as a healthcare service delivery platform, Kalinga Health, as one-stop clinical hub and diagnostic hub, we're serving these people. So their voices are the most important to be considered in improving the quality of care that we deliver.
Thank you, Doc Jace, for those insights, and that you really need the voices of the people to continue improving your service in the system. Mayor Coro?
Again, good evening to everyone, and thank you for the opportunity to share our story of how we with the Seal of Health Governance. The biggest impact, I think, with the community engagement and self-monitoring is how we perceive health. With the Seal of Health Governance, monitoring done by the local government and the health professional health practitioners, you see yourself as a beneficiary. And when you do community monitoring with the self-monitoring, uh, you become part of the ownership. So you become part of the health process, not as a beneficiary, but as part of the health process, trying to also influence the desired health outcome. And I think that's the biggest take that from my understanding of what we are trying to achieve and how we are moving through the process of this engagement is really to increase their participation in the process of owning the health outcomes. And that, I think, it's in itself, given that in rural communities the complexity of how we deliver health services varies from a mountainous region to an island community to a poor urban poor. There are different ways and methods of how we deliver health services. But by allowing them to participate in the process, not as a beneficiary, but as a owner of the outcome, uh, I think there will be better health results, and hopefully it will also translate into increased health-seeking behaviors to really have the desired outcomes we want.
Thank you, Mayor Coro, and for sharing that this strategy has somehow contributed to the ownership of the people and how they value health all the more by being participants in the process. So I see several questions already in the chat box. It's really good that we have a very active audience. So I think we could ask this to Dr. Joey also, and maybe Mayor Coro and Jason also has insights on this. But Coben is asking that for the two projects, the CES and strategy, were the local monitors, I think, were they already established community leaders or volunteers, and taking into consideration any possible power play or any power dynamics at play in the process. So maybe some insights from the project team, Dr. Joey, and then also Mayor Cor and Dr. Jason. Dr. Joey, can you share the experience on this? Can you unmute po?
Yeah, maybe if I can start, I would like to assure everyone that there was no power play and that we had no influence on the selection of the monitors. So it was all about the program. We just supported on some other logistical needs, just to ensure the integrity of the result. Thank you.
Thank you for that disclaimer, Mayor Cora. Maybe also Pao, Dr. Joey is already unmuting. Can you share po?
Good evening, everyone. So as a field documenter, actually, I really supported the statement of Mayor Coro and the choosing of the local monitors based on their village leaders. So they were the one the council who choose the local monitors who will do the implementation and the data gathering in their village. Thank you.
Thank you, Dr. Joey. So there was already somehow they were already known, right, in their communities, and I think Pao also mentioned in the presentation earlier that they were already like active members of the community, but they were existing volunteers also. And Jace, you unmuted yourself. Would you like to add to that, and also maybe share a little bit about the relationship of Kalinga Health with the communities it serves?
Sure. Kalinga Health is basically an NGO-funded project, initially internationally funded project. It's now self-sufficient in terms of serving the needs of the community. While it's a one-stop shop for anything health-related, consultation, diagnostics, the bread and butter would still be related to tuberculosis care, because we try to link public healthcare facilities like free medications for tuberculosis to private sector patients. Because just a backgrounder, I think this may be true in some of the countries from where our audiences are coming from. people from the marginalized community, they still seek care from private sector, thinking that they will receive better care. But it's not usually the case. So we try to empower and improve the care delivered in the private sector. Now, as to the question in the chat box, I think I would like to bring back on the table what Pao mentioned earlier during the selection of the local monitors. I mean, the monitors were selected depending on different criteria. However, after giving an initial training, they were left for their own selves. So they are the ones who implemented the whole project, and the documenters are just passive observers documenting what's happening on the site. In our case, we do have two sets of monitors. First, we do have the community members, community leaders, similar to somehow to Del Carmen's experience. We got people who are already known in the community, people who have been engaged by our NGO in other similar projects as well, because we know they can speak for their own selves. I think that's largely culture specific as well. Filipinos, as an Asian nation, we don't normally speak out our minds. So we have to pick these empowered individuals so they will be empowered as well in terms of enforcing some indicators to monitor. The other set of our monitors belong to the doctors, private sector doctors, who are partners in our hub and spoke network. So this one, we've been engaging them for at least 2 to 3 years prior to the CESM strategy. And the volunteers were our local champions already. So they were naturally inclined to support whatever we are doing. So they have a strong stake with what we do, but we don't pay them anything. So they're just advocates, if we call them as that. So they are usually GPs, pulmonologists. So I think that's for our experience in Kalinga Health.
Thank you, Dr. Jace, for sharing your experience and really picking, sort of mapping, right? Those who can really serve as monitors and really add also to the process. Dr. Meredith, your hand is raised. Would you like to add?
Yeah, just to add to what Mayor and Dr. Jace has already mentioned, because I think this is an important principle in the strategy, the power to select and even remove and replace local monitors were actually given to the community. So by community, this was represented by the council and some of the volunteers. So to answer that question, most of them, if not all, are also volunteers. So they are not, as Dr. Jace mentioned, being paid to monitor. So just to give you a picture, in the Philippines, most of them in the pilot study were barangay health workers, but there were also others who were not BHWs who were selected as monitors. So this came from them, and also the criteria, even the indicators, what to monitor came from them, and SIHI and the documenters were just facilitating and just in the background. So I think that's a very important point.
Thank you for adding that, Dr. Meredith. There's another question here in the chat box, and again, I think Mayor Coro and also Jace can give insight to this, or regarding the next steps as well for this strategy, because Jacqueline would like to know if there has been progress already in regard to integrating this strategy, the CESM, into local policies, so like ordinances. So she says this is really an important recommendation, of course, for the sustainability of the strategy and also of the innovations that are being monitored. So Mayor Coro, being the local chief executive, what are your plans and are they already underway?
Yeah, thank you for that question. Actually, the Seal of Health Governance is already integrated in our local ordinance as part of the Public Health Ordinance, which was approved by the Sangguniang Panlalawigan already. So it's already in play. What we're trying to do now is to examine the existing ordinance because of the universal healthcare introduction in the Philippines, and how we will be integrating universal healthcare into the local public health discussion and programs. At the same time, there's also an evolution in our in the local government with the devolution, with the full devolution implementation. There's a lot of things happening in the local government level in the Philippines right now. Now, with the integration of the CESM, we're hoping actually that the structure of the policy would be one of the outputs of the study. As earlier mentioned, when we did our introduction of the program, that we were hoping that there would be a how we will be structuring the CSM so that we could provide clear visual about how existing innovations in public health services delivery in the local government can be integrated as part of the community engagements. So we need help on that aspect because it's very difficult for a local government who has no medical background experience, and we might have a different interpretation of how we will be dealing with health outcomes. So we're just very particular in that, similar to what we went through with the public health ordinance that we built. It took a while because there are components that would really need medical expertise, and the community side definitely we could handle it, but to make sure that we are getting the right outcome that we want, we need really help on that aspect. So uh, we hope that we continue this engagement until we could come out with a template that can be replicated by other local governments as well.
Thank you, Mayor Coro, for sharing that. And we see the policy landscape. No, there are challenges, as you mentioned, with the devolution and also the implementation of the UHC law in the Philippines. But then there are also opportunities, and we see how dynamic your local government is in revising policies and adding even more services and structures. Chase, can you add also to that, maybe regarding policy and also integrating, these strategies and your innovations in the health system?
Yes, I'm about to give some thoughts about it. Well, to be honest, since this was a pilot implementation, we never continued it as it was designed. However, the principle of increasing the voice of the community members, our stakeholders in this case, empowered prior patients or community members, and our private sector partners, our private physician, was elevated high into our consciousness. And how it was manifested, first, during our regular review, M&E review, basically, that's monthly and quarterly, we have started inviting them to join our sessions so that they could continue somehow monitoring and giving their feedback. And interestingly, we found ourselves writing newer proposals, including a similar approach in our M&E plan, because as the others may not be that familiar, if you're sending proposals for a public health project or for a research or whatnot, there should be some sort of an M&E strategy that you have to implement if you are given the grant. And we have increased the participation, such as including lay people, empowered community members, in terms of evaluating the M&E of our proposed projects. I guess those are two baby steps, I would say, in which we were consciously or unconsciously imbibed the principles of CESM after the implementation.
Thank you, Jay. So it's really good to see how it's being adapted, even the principles, and that's part of the learning process, right? And then embedding it into further opportunities. And so we're excited for whatever is next also for Kalinga Health and ICH. There is another question here that maybe some of the project team members could also answer. April is asking if we can expound on the difference of this approach to existing participatory approaches that are used for other public health programs and projects. Because we know community engagement has always been there, participatory approaches. So maybe what is unique in this, Pao or Doc Meredith, maybe you can shine a light on that.
Okay, so I think what sets it apart from other participatory projects is the inclusion of the practice sessions and the capacity building activities. So this actually concretizes what people-centered approach is. And by doing so, we really inculcate in them that they have the power to change what they think does not work and to continue what works for them. So I think, Doc Medit, if you have anything to add.
Yeah, thank you, Pao. So I affirm that, no. So capacity building and praxis in between. So it's integrated in the process. So in phase 1, what we did was just to let the community do anything that they like, anything that they want to do. But in phase 2, we realized also based on their feedback that they needed some, competencies and skills that they still do not have, and they were asking for assistance in this. So that's why we integrated the capacity building process. But side by side with that was the praxis session. So during the praxis session, it was just facilitation of what they learned, what they thought were challenges, how do they handle these challenges. So the solutions, both the challenges and actually the solutions, also came from the local monitors themselves. So this was like a safe space of learning together and cross-pollinating the learnings that they got from their community. So the good thing was we gathered them regularly, the two communities. So as Pao has presented earlier, this is a bit, these two communities are very different, even geographically, and its component and composition. But during the praxis sessions, the learnings, both sides of the local monitors were very enriching. And I think that has helped the participatory process to be more strengthened. So yeah, over to you, Han.
Thank you, Dr. Yes, Mayor, go
Doc,
ahead.
may I add,
Yeah.
just to highlight probably the difference between the participatory programs that are being espoused by the government versus what we are trying to do. Again, if I may reemphasize about the impact that we saw, it's really on to expound on what Doc Meredith was saying. It's because there's now a sense of more ownership, because in the previous process that we did in participatory engagements with the community, it's still pretty much the local governments and the experts that are trying to influence the way they would decide, and therefore there is a clear potentially influence on the outcome. But with community engagement, trying to distance yourself, you allow them to participate in the process with more confidence and allowing them to see the potential impact of their decision. And I think that that's a very good process, but it's a very difficult process to take, because allowing they might lose themselves in the process, but they might start blaming themselves if the outcomes might not be as what we hope to achieve. But it's the curve of ownership that I think it's very important as we enter in a more complex, uncertain times of healthcare, climate, and everything that's being thrown at every community there is. I think that ideals of having them to be part of the process of developing the solution, trying to make them owners of the outcomes is very, very important, especially in this current times that we are in.
Thank you for that, Mayor Coro. And I think one of the striking results that Pao actually shared earlier is that the monitors now, from just collecting data, they now know how to interpret it, somehow analyze, and even because of that, to advocate for what they need from the government, from the other leaders. I saw a raised hand earlier from Dr. Giohari Hamoy. Would you like to unmute and share to us your question?
Yeah, I'd like to ask actually Mayor Coro. Mayor Coro, very commendable, what you did in your place. Actually, my question is connected with how this the results of this the results or what you did in your area. Have you shared this to the other leaders, like the mayors? For example, I know Doc Jana, Doc Pao, they are my interns in Cavite, and how I wish, Mayor, that you're one of the mayors that we are engaged with, no, in UP Manila, because talking with you, I mean, like the way you talk, you're like one of my colleagues, no, co-faculty in the UP Community Health Development Program, very engaged, and that's what we actually really like. But of course, our mayor in one of the municipalities where Jana and Pauline went before, he was proactive, but what you did was really the next level. So I'm just curious, have you shared this to other mayors, to other leaders, and how they receive this? Because it's, of course, very important that it's not just going to happen in your place, but in other communities, in Luzon, in Visayas. So that's it.
Thank you, Doc. The Seal of Health Governance program itself, we've been using the program since 2013. If I remember correctly, it's been a long time. We've been sharing the process of the Seal of Health Governance, how it was developed to different municipalities, cities, and regions in the country, and actually even beyond. We had the privilege of sharing it with some other countries that would try to look into how to get communities to be more participative in the process of health services delivery, especially with many issues of how of limitations in resources and everything. There's really a need to get the community to be more engaged in the process of understanding how health impacts their other social outcomes. But with the community engagement self-monitoring program, we have yet to share the process because I'm still waiting for the policy side before we try to work it out with the other local governments. But definitely, it is something that we are more than willing to share to everyone, given the opportunity, especially with the right data that we could prove that before and after there is a better health results, especially in the communities that we work with.
Thank you, Mayor Coro. I know we're almost at 9 p.m. here in the Philippines, but I would just like to ask the audience so we can extend a little bit because of this very good discussion. And I would like to ask at this point, Ma'am Delia, you're here again already, so thank you very much for joining us. We'd just like to learn po what were the main challenges in implementing the CSM strategy. And so moving forward, if you want to continue this, what support do you need for this strategy? Ma'am Delia and maybe Ma'am Joey can also answer. Sige po, we can hear you na po. But I think it's getting disconnected a bit.
Sa phase 1 po, talaga kami kasi data namin yung and kasi nung binigay na sa taas, talagang wala kami idea para ano bang may namin. So, yun. Maraming nagtatanong na mga different para saan ba talaga to at anong makukuha ko. Wala kaming masagot na magawa na lang para
I think Ma'am Delia
doon
is
sa support
getting...
din po.
Okay, yes, please continue po.
Pag may phase 3 pa, sana may full support na ng namin, mga barangay officials, at saka rin kanila. Once na first,
yeah.
Talaga na pag may phase 3, support talaga PLPU. Yun.
Okay, thank you very much po, Ma'am Delia. She's one of the local monitors in Del Carmen, and I think Pao can also add to that and interpret also what Ma'am Delia shared.
Okay, so thank you, Ma'am Hannah. From what I got from what Ma'am Delia said, so she said that during the first phase, they were pretty lost about what to do. So they weren't sure what it was for. So at the start, they were mostly doing it out of compliance. And then the second phase comes, and this time there were capacity building activities. So this time they were able to understand why it was being done and how it is gonna be of benefit to other people. And Ma'am Delia, I was actually talking about phase 3 already, and she said that in phase 3 they hope to get the full support of their barangay or their village leaders in order to really be able to sustain and to do the strategy in a number of initiatives. So there. Thank you,
Thank
Ma'am
you
Hannah.
very much. So thank you, Pao. And I would also like to ask Barangay Captain, Honorable Raquel Barquilla. She's able to join us now. I would just like to ask you also, ma'am, what were the biggest factors that made the implementation successful? And what was the effect in your community po of this strategy?
Yes, hello po. Good evening, everyone. The important element that contributed significantly to the success of CESM in our community is one is the clarity of purpose, and that second is the growth mindset, and then the third one is courage. So the program really helped, and it's the same Delia, that in the first place and the phase we are struggling, and then some monitors don't know what to answer, and very thankful that you extend for the second phase, which I already seen the result that it's plays an important role, became a big it helps a lot to us here in the community how to be resilient, and the importance of health also, because in here in the remote area we are not so not everybody in the community are aware of the importance of health, especially us here. Almost everybody is sufficient depend on the fishing. So fishing, we depend on the fishing. So fishing, we are we are some of the community are not really engaged, or did not give importance of health. But now, after the monitors got some interviews, everybody already knows, and it is clear already to them that everything that the program is intended for us, for the success of the program. All we have to do is um, to participate the program, getting in touch always, and because of the help of also of Dr. Joy, that she is um very helpful, giving her knowledge to help us, motivated us, giving also some idea regarding on how to face the, or how to entertain, or to tackle the behavior sometimes of the community. We are changing our mindset that no idea is wrong, because all the idea is acceptable, and nothing is wrong. By that, it was motivated an interaction between monitors and the community. So it's a first step for getting details, and the first step for a success that it's come from Dr. Joy, and also to our mayor, active mayor. I am thankful that we are chosen to be one of the benefactor of the program, because this is our barangay really needs help regarding on health.
Thank you very much, Cap Raquel. So, Honorable Raquel is the barangay captain of Barangay Kaup, the island barangay in Del Carmen. Thank you for emphasizing the needed certain level of capacity building and support to do this program, and how it encouraged awareness and participation among the community. So, sorry, but in the interest of time, we need to cut short the discussion at this point. But before we close, we still would like to, of course, thank our panelists, and also maybe a virtual round of applause for them, please. And then at this point also, we would like to invite SIHI advisor and community engagement expert, Dr. Uche Amazigo, for her short response and synthesis. Dr. Uche?
Yeah, thank you very much. And thank you. First, let me thank Beatrice for approving my initial proposal to on CESM. I wish to really congratulate Dr. Meredith Powell and the entire team, the SIHI Philippines, the Secretariat, the Barangay. I'd like to thank Mayor Coro and Jason for moving this initiative forward, and the lead role the communities played, the barangays and the local monitors in particular. I think they have shown us that it is possible to shift power for change, and that we can only improve our health systems when we allow communities to make decisions for themselves and for their lives, and then build the capacity, as Meredith also emphasized, the need to build their capacity to listen to them and to allow them to develop the process. So I want to thank the panelists. I would also like to make 1 or 2 points on this. And that is on the question of future collaboration, scaling up. Well, how do we go about it? How do we get potential collaboration and partnerships? I think we can look at the national, for countries or hubs that have the national, the neglected tropical disease programs in their countries. It might be good to reach out to them with CESM to enhance their activities in order to achieve the WHO NTD elimination roadmap in every country. And also those countries that are running, immunization programs. I see that the communities through the CESM can play a major role. The also important way we can build partnership with the WHO NTD program in Geneva, and present to them this package and see whether they can promote it in a very solid way for effectiveness and sustainability of the distribution of the NTD drugs. So finally, I'd like to thank the hubs who joined us today. I want to thank Dr. Meredith again for your excellent leadership role throughout phase 1 and phase 2. And I thank the communities in particular. Thank you very much. Thank you. I thank the panelists, because without you, we would not have heard how this program, how the phase 2 in particular and phase 1 have impacted on the lives, and now you're moving it forward from one local government to another. I do hope that other hubs will take on and continue to continue to spread the role of community self-monitoring, community engagement, and the power of the communities to do more. And of course, you have emphasized the fact that the communities determine their own indicators, determine their own monitors, and are able to change monitors when they are not happy with the performance or for reasons not known to us. So that is a shift in public health, a shift in international health that we need to do globally in order to bring more of our people to have benefits of healthcare services. Thank you very much.
Thank you, Dr. Uche, for your insights and also for giving us already some ideas for the future. At this point, we will be closing our session already, but we would like to call first Dr. Meredith Labarda, the lead both of the SIHI Global Network Secretariat and of the SIHI Philippines Hub, for the closing remarks and also a call for partnerships.
Thank you, Dr. Hannah. I'll just take 2 to 3 minutes for this. But I think let me thank first Professor Amazigo, Dr. Uche, for introducing CESM to SIHI. And we had the opportunity to pilot this here in the Philippines. We have a lot of learnings already. We're excited to share, not only in the SIHI network, but of course in different communities that are that this would be relevant also. So just to emphasize 2 points in the discussion that we had earlier. Number one, from our panelists, it is possible for communities to contribute and be part of the health system processes and not just become beneficiaries, and wait for things to happen. And we've seen this in the CESM process. And the second point, as what Dr. Uche mentioned, it is possible to shift power for change. And if I may add, to shift change for the better, for better health outcomes in our community. And I think, as Mayor Coro mentioned earlier, these are very challenging and complex times. But I think this is also the time for the communities, to take ownership of not only the challenges, but also the solutions to the problems that are happening in our society. So with that, I'd like to thank all the panelists that has come tonight, all our guest partners, and of course, members of the SIHI network who are here with us tonight. And of course, Dr. Hannah, who has facilitated this session, and Dr. Pao, our project manager for CESM, and the whole SIHI team. Thank you very much. And let me close by an invitation to partner. And I think Dr. Harry has already started in the chat box. If anyone is interested to pilot this strategy also in their context or in their setting, we will be happy to take the discussion offline. Maybe we can explore ways to go forward. So thank you very much. And as we say in the Philippines, padayon, and let's continue our work and engaging our communities. Good night.
Thank you very much, Dr. Meredith.
Yeah.
Yes, and thank you very much to everyone. Thank you for participating in our SIHI Talks. And we hope to see you in future SIHI Talks and other SIHI activities. So have a great day. Have a great night.
Thank you. Bye-bye. Bye-bye.
Thank you, Mayor.
Bye-bye.
Thank you, Dr.
Thank you.
Jace.
Thank you
Hi,
all.
Mayor. Thank you, Dr.